Throughout this course, we've been talking about different types of policies for alcohol. We've talked about how to evaluate them very briefly, and we've kind of gone through the gamut of types of policies that could be implemented, whether for overall alcohol consumption or for specific consequence of the alcohol consumption. But what should we consider to be the most effective, and what should we consider to be the least effective? Well, the most effective policies for alcohol consumption and in the alcohol control field influence the price, availability, and affordability of the product and decrease drunk driving. Those are the ones that give us the most benefit, most public health benefit. So alcohol price policies, just tax them like crazy, whether it's through an excise tax, a sales tax, or particularly using minimum pricing, either minimum pricing itself or minimum unit pricing like that's been implemented in Scotland. Those will be more effective than an excise tax and a sales tax, but any way to artificially increase the price of alcohol will give you a positive public health benefit. And this will have greater influence on heavier drinkers because they simply spend more on the product, and it will also have a greater influence on youth and teens who might struggle more to pay for these higher costs. Availability policies focus on the hours and days that alcohol can be sold. It also focuses on location, so where alcohol can be sold, as well as density. So if there's a way to limit the amount and the number of alcohol outlets, whether on-premise outlets or off-premise outlets in a neighborhood, all of those could be used to reduce alcohol consumption and the negative consequences of alcohol consumption. When we talk about accessibility, we're talking about two different types of populations. One are those that are underage. So increasing the minimum legal purchase age laws for alcohol will decrease alcohol consumption, and in lowering these ages actually increases alcohol consumption and the consequences of alcohol use. And putting prohibitions in place, laws on the book saying you can't serve intoxicated customers. That will also decrease accessibility of the product to those who are most vulnerable and hopefully decrease the consequences of use. Now, drunk driving. There are a lot of drunk driving policies. Some indirect drunk driving policies are what we already talked about. They influence price and affordability and availability. By lowering those, by increasing price and lowering availability and affordability, you ultimately will lower drunk driving. But direct drunk driving policies that are considered effective are things like blood alcohol concentration limits, zero tolerance laws, administrative license suspensions, interlock systems, punitive classroom education, and sobriety checkpoints. Now, the thing about these is that some of these have larger areas of effect than others. So blood alcohol concentration limits will apply to the entire population. Things like ignition interlocks, mandatory treatment, even administrative license suspensions, those are really going to only impact the people who've already been caught once. So you're gonna, even though they're effective, they have a much lower population reach than some of these larger policies that affect everyone all at the same time. Potentially effective policies, now I say potentially because they really have theoretical effectiveness. We don't really have the data to say that they do actually work on a population scale. So what are marketing restrictions? We had a whole module just on alcohol marketing, and the research tends to show almost without fail that the more exposed someone is to alcohol marketing, the more they're going to drink. Now, the effect isn't large. It's not they're going to double or triple their alcohol use, but it's something in the 10 to 20% range, and that's not an insignificant amount of use. But the problem is that most research has focused really on marketing exposures. There's very, very little research on the impact of marketing restrictions. So if we go back to very strict restrictions outside of bans themselves, to France's Loi Avène. The Loi Avène was put in place in 1991, and there really aren't any good evaluation studies on whether that law decreased alcohol consumption and decreased the negative consequences of alcohol use in that country. So we think putting strict marketing restrictions in place will have a positive public health benefit, but we really aren't too sure. We need more research to say so. Focusing on treatment and early interventions. Now, These could be effective, but they're very expensive, so we have to kind of put up a lot of upfront costs. And they really do only affect a small number of people. If we're doing treatment, it's really only affecting the people who are alcohol dependent or who had been in a drunk driving accident or something along those lines. So they're effective at the individual level, but we need more research to say whether they're effective at the population level. And then drinking context, changing the drinking context, making it harder to drink, making it harder for people to access alcohol in certain areas. That's really only applicable to on-premise drinking, so bars, restaurants, and nightclubs, things like that. And again, we simply need more research. Theoretically, if we make the drinking contest less conducive to heavy alcohol consumption, we'll see positive public health gains, but we don't have the research demonstrating that as of yet, not enough of it anyway. Things that are really ineffective, even though we want to do a lot of it, are things like classroom education. They're pretty much every school system at some point in time will expose their children to or their students to anti-alcohol education or anti-drug use education, but it really doesn't work. And when mass media campaigns are used alone, when the effect is only supposed to be the mass media campaign, they really don't work either. When they're combined with other programs, so an informational a mass media campaign combined with sobriety checkpoints, for example, that might be effective. But really, when they're operating on their own and they are the principal intervention, they don't seem to work very often.